Postmortem hypostasis part 1. This is the bluish purple or purplish red due to deoxyhemoglobin discoloration which appears under the skin in the most superficial part of the dermis retymugosum of the dependent part of the body after death due to capillary venous distension. It is also called a postmortem staining, subcutaneous hypostasis, liver mortis, cadaveric rigidity, sugillation, vibisus, and darkening of death. Mechanism: it is caused by stoppage of circulation, the stagnation of blood in blood vessels, and its tendency to sink by force of gravity. The blood tend to accumulate in the toneless capillaries and venules of the dependent part of the body. Filling of this vessel produces a bluish, purplish color to adjacent skin. The heavier red cells tendency have settled to first bearing a deeper color of the affected part. The upper portion of the body drained of blood are pale. Upper portion pale. The intensity of the color depends upon the amount of the reduced hemoglobin in the blood. In case of large amount of reduced hemoglobin before death, the blood has deep purplish color. The color of the hypostasis may vary from area to area in the same body. In the recently dead or lying tissues, oxygen dissociation takes place, which is continued until the equilibrium is reached between the tension of oxygen in the capillaries and the surrounding tissue. There may also be backward flow of venous blood from the venular end of the capillaries, which add the blueness of the blood after death. It is not possible to distinguish the postmortem discoloration from that produced by cyanosis in the living. Next is development. After death, postmortem lucidity begins shortly after death, but it may not visible about half to 1 hours after death in normal individuals, from about 1 to 4 hours in anemic person. Dully red patches of 1 to 2 centimeter diameter appear in 20 to 30 minutes to 2 hours. These patches then deepen, increase in intensity, become confluent to 1 to 4 hours. In the early stages, this patch can be mistaken as for a bruise, deeper and bruise. In doubtful cases, a portion should be removed for a microscopic examination. The areas then enlarged and combined to produce extensive discoloration. In some bodies, isolated patches of lividity remain separated from the large area of lividity, resembling contusion, frost, erythema. Hypothermia induced red purple spots seen over the prominent parts of the body, such as shoulder, knees, elbow joint, may sometimes be mistaken for hypostatic patches. The circulatory stasis in the aged, sometimes after the effect of the cold, resembles the effect of violence. Such marks are usually found on the ears, shins, forearms, hands, where the circulation is comparatively poor and skin is exposed. When lividity first develops, if the end of the finger is firmly pressed against the skin and held for a second or two, the lividity at that part will disappear and the skin will be pale or white. When the pressure is released, the lividity will reappear. The plasma tend to cause edema of the dependent parts and contributes a cutaneous blisters of early putrefaction. In the early stages, a mottled patches of A mottled patches of hypostasis may be seen on the upper surface of the body, especially the legs and the thighs, due to uneven dilatation of the vascular blood. These patches soon join together and slide down to the dependent parts. It is usually developed within 4 hours to and reaches maximum between 6 to 12 hours, that is primary lividity, and persists until putrefaction sets in. It is present in all bodies, but it is more commonly seen in the body of fair people and those of dark. It may not be appreciated in old and anemic persons. The shifting of lividity. If the body is moved within a few hours after death, the patches of lividity will disappear and new ones will form on the dependent parts, that is secondary lividity. But lividity to a lighter degree remains in the original area due to staining of the tissues by hemolysis, that is complete shifting. This may take from few minutes to 1 hour. In incomplete shifting, after turning the body over, lividity appear slightly in the down face parts. Next is intensity. It is intense in asphyxia, where the blood may not readily coagulate, but in cases of sudden death within a short agonal period and great circulatory blood volume. It is less marked in death from hemorrhages, anemia and wasting diseases due to reduced amount of blood and pigment. It is less marked in the death from lobar pneumonia and other condition in which the blood coagulates easily. Sometimes a bluish hypostasis become pink color along the upper part of the horizontal margin and the lower parts remaining dark. This is due to hemoglobin being oxygenated, where the erythrocytes are densely packed in the upper layer of hypostasis. Next is about extent of lividity. It is mainly depends upon the volume of blood in circulation at the time of death and the length of time that the body remains fluid after death. Hypostatic congestion resembling postmortem hypostasis may be seen a few hours before death in case of a person dying slowly in circulatory failure or some infection, cholera, typhus, tuberculosis, uremia, morphine and barbiturate poisoning, congestive cardiac failure, deep coma and asphyxia. In such cases, hypostasis will be marked shortly after death. Lividity can be appeared shortly after birth in a person dying slowly from circulatory failure. Next is about petechial hemorrhages. Petechial hemorrhages, numerous squares or fine petechial hemorrhage may be present in the hypostatic area in death during an anoxic state. They are very common in narcotic poisonings and in sudden collapse due to acute cardiac arrest. Petechiae may be seen in hypostatic area in 12 to 24 hours due to rupture of the small vessels. Thank you.